You said prepare. That really is like a trigger for me because we
Of course, prepare.
didn't
And
really prepare a whole lot. I mean, we
and
still
there's no excuses for SNU. For example, SNU,
this
the air
chiller.
conditioning
Oh
doesn't.
my
Yeah.
god.
Dr. Shea, we're going to bring in Dr. Akimoto, do a side by side with you. I don't know if he knows how to do this.
Hi,
Go ahead.
Dr. Yakamoto. You there?
Let me unmute him.
Yeah, we're going to unmute him. Are you sure you want to unmute this guy, though, Jay? Are you
Oh
sure you
yeah,
want
yeah.
to
What is
unmute him?
that? Unleash the Kraken!
I don't know if I want to unmute him.
No, he's good.
Hi guys.
Good
Uh,
morning.
Good morning. Yeah. Hey, thanks for not letting me wait. It was only 3 minutes today. Thank you. Really appreciate it. Hi, Dr. Shea. How are you feeling?
I
You're
feel
wearing a
great.
mask.
I
wearing a mask.
I don't need
Be
to wear a
careful
mask. I'm by
today.
myself.
No, Dr. Shea has been working nonstop since March. He knows what's going on in the hospital. We're concerned because he and his nurses are on the front lines, and from the very beginning, we had been advocating that they move the women and children to GRMC for safety, and GMH had refused. Dr. Shea had actually led a whole contingent of doctors and nurses to see if GRMC could handle this, and of course they can. They have a beautiful facility, but today is really about Dr. Manglonia. This is about, I think, Dr. Shea and I responding to Dr. Manglonia's accusations yesterday that the community of Guam had somehow failed, that we had not listened to Dr. Shea about washing our hands, that we didn't maintain our distance, that somehow Dr. Manglonia, in her eyes, the only reason people are dying and that the hospital's been overwhelmed is because we didn't listen to her. I don't know how Dr. Shea feels about it, and maybe I'll have to come off if I start using bad words, because FEC has this like red dot on my forehead right now. But the idea is Dr. Manglonia has consistently belittled the doctors of Guam, the people of Guam. I mean, it looked like she was coming to Jesus for a little while in the PAG and actually making friends. But then yesterday, I don't know if she's racist, incompetent, or she just doesn't like people, especially if they don't work in the government of Guam. But how can you accuse all these business people who have spent hundreds of thousands of dollars to try to be safe and stay open? How can you blame Dr. Shea, who sacrificed his family by being in Hawaii? They're in Hawaii, but he's working his butt off. I mean, and he's in the private sector. He has staff that work with him and see people every day. How can you accuse these people of being the reason that we're in this situation? And basically she's saying, it's your fault, live with it. If you're not gonna listen to me, then fuck you.
Ay, 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 ay.
If she's gonna do that, I mean, why the hell do we keep having her, come on the air? She's toxic. She is toxic.
She's the medical director of public health, Doc.
Governor's gonna have to figure out, are you gonna use this? I mean, because today the virus is not the bitch. Jana Maglonia is a bitch. This is terrible.
Okay.
This is terrible. Yeah, soak in it. Let it marinate. Because yesterday's interview with her should have infuriated the entire Chamorro Nation. She accused them of not knowing how to wash their hands, to stay in place, and to listen to her. She's a pompous bitch.
All right, let's
Have
go.
a nice day.
Okay. Thanks, Doc.
Doc.
Right on. Well,
Doctor.
Whoa.
yeah.
Am I muted or am I still?
Yeah. Okay.
Well, I can understand the passion that's coming out of my friend Dr. Akimoto there, and bless his heart, I think he needs to have a cup of coffee, decaf.
No, not coffee. Yeah.
He's doing that
I think he
right
needs to
now.
have a cup of cannabis.
Yeah, decaf. And that's not a cup. That's 5 cups in a cup.
Yeah.
But anyway, I think
Okay,
I can understand the passion. I can understand the passion that Dr. Akimoto doesn't like the criticism on the people of Guam. Now,
Right.
going back, if we can go back on what Dr. Akimoto is saying, okay? Why aren't we trusting the people of Guam? Why are we locking them up? The residents who's coming back from off island, I've always advocated, if they have a house here, if they have a home here, please, Governor, do not lock them up in a government facility. I don't care if it's the Hyatt, Dusetani, wherever it is, Wyndham Hotel, Bayview, wherever it is, put them back into their homes.